So I got the thumbs up. As I said, my name's Josh. Welcome to the webinar that we're going to give tonight about Regenexx Las Vegas and some of the things we do here at our clinic, and discuss alternative options to orthopedic surgery. So as I said, my name's Josh. I'm the doctor here at Regenexx Las Vegas. I will be the one walking through the webinar and discussing some of the things that we do. Everything we do is very specific to orthopedic care, providing non-surgical orthopedic care. So kind of the format is just a little introduction of myself, what Regenexx is, discuss some of the typical orthopedic treatments that are available, which a lot of us may have encountered these already. Give a little brief overview of some of the alternative type of treatments that we provide here, discuss how we make decisions on if what we do would benefit our patients. So walk through our evaluation process and discuss some of that. And then at the end, we will have a little question and answer time where people can kind of write down some of the questions in the chat or the Q&A section, and I'll try to run through all those questions at the end. You can jot them down as we're going through the webinar, but I'm not going to stop and answer them as they pop up. I'll just do it at the end, just so they can be a little bit more efficient and not break up the webinar too much. We'll try to move through this quickly to not take up too much of your guys' time. The biggest thing is just planting the seed and getting people thinking about alternative treatment options to orthopedic care, and to look into some more of these different options in hopes of helping to improve anyone's orthopedic pain or dysfunction related to some type of orthopedic problem. A lot of what we do and what we're going to discuss are really more minimally invasive, just injection-based procedures that kind of fall under what people call regenerative medicine, where we're utilizing cellular-based therapies and injection-based therapies in hopes of joint and tissue preservation. That's kind of our goal, is to help people preserve their orthopedic tissue and try to avoid surgeries that may remove or replace tissue. So that's kind of our goal. Like I said, feel free to ask questions and write them down, and then I'll cover that at the end. We'll have some contact information at the end as far as getting a hold of our patient education center to get scheduled for an evaluation or to get more information. And obviously, there's always information on our website, regenexxlasvegas.com, or you can look at regenexx.com. That also has some information as well. So as I said, my name's Josh. I'm the doctor here at Regenexx Las Vegas. I've been with Regenexx since 2015. I am board certified in physical medicine and rehabilitation. So I grew up in New Mexico, did my medical school training there, moved to Texas, did my residency training. I am fellowship trained in sports medicine and interventional spine. During my fellowship, I did get involved with conducting research utilizing bone marrow derived cells for low back pain and disc degeneration. And as I said, I've been with Regenexx since 2015. I've been at the Nevada clinic and I'm the owner of this clinic, and I've been here since 2018. I did spend time at the Des Moines, Iowa clinic, which is currently the corporate headquarters of the Regenexx organization. I performed thousands of Regenexx procedures, co-author on some review articles for the utilization of stem cells for low back pain and disc degeneration, although we treat all orthopedic conditions here regarding different joints, muscles, tendons, spine, those kind of things. And so a lot of what we're going to talk about, just kind of a basic review, is again going back to orthopedic conditions, since that's what we treat at our clinic. and just having an understanding that these types of conditions affect people of all ages. Usually when we're younger, it's more overuse and traumatic type things. As we age, we start to get more degenerative type conditions. And so orthopedic problems affect many people. They are very costly to treat, both direct and indirect. And that's going to include the direct treatment of surgeries, medications, injections, time out of work. All of these things need to be taken into consideration as far as what needs to be done and how our lives are affected from orthopedic problems. Many of us have some sense of what's typically done or how we kind of self-treat orthopedic pain. We take medications over the counter or get prescription medications, which could include your anti-inflammatory medications, Tylenol, topical ointments, pain medications, muscle relaxers, nerve pain medications, all these things. There's injectable type solutions that are typically done. Historically, it's been more of the cortisone-based injections, which we'll talk a little bit about, why people may want to avoid those. If your goal is joint preservation, you're just going to want to avoid those steroid type medications. Some people will do well with physical therapy and bracing. Some people do need surgery. So that's still an option and still needed in some cases. But as we're going to talk about, we hope to be able to provide and treat people in hopes to avoid things like this, as long as we can catch people in a time and in the path of the degenerative process to help kind of prevent the progression to that. So just thinking even about just simple medications that we use on a regular basis, people take ibuprofen or those types of medications a lot. It's prescribed a lot, but they do have their own set of complications and risks. There are people that actually die every year from the use of these types of medications. Hospitalizations occur. They increase the risk for strokes, heart attacks, can increase blood pressure, allergic reactions, stomach ulcers, kidney dysfunction. And so we got to think about all of those things when we're just popping these pills, especially if we're doing it more chronically. We have to be aware of some of the adverse reactions and adverse effects of these types of medications. There's actually more studies showing that the chronic use of these types of medications, which we call NSAIDs, actually increase and can lead to chronic joint pain. So things that we learn as time evolves and as research comes out. And then the cortisone type injections, there's many different brands of corticosteroid type injections. These are typically used for many different conditions, but in orthopedic realm, it's like inflamed tissues, arthritic pain, tendinitis, those kind of things. And it is a strong anti-inflammatory, but it does carry some risks with repeat exposure. And so some of the potential complications are over here. So increased blood sugars, weight gain, flushing, anxiety. It's toxic to your cartilage, specifically with repeat dosing, and it can accelerate osteoarthritis. It can lead to subchondral, so bone like kind of stress fractures. It can lead to death of the bone, rapid destruction of the joint. They can lead to accelerated need for a knee replacement or hip replacement. So the more injections you get, the faster you actually get to a knee replacement or joint replacement. So things like that we need to be aware of before we start to choose those as the treatment option of choice for our joint pain. And there's different studies looking at the adverse effects. These are only a couple, but there's many, many out there looking at how cortisone affects our bodies. And then kind of getting into some of the surgical type things to consider. As we all know, surgeries tend to be more invasive, right? They have to cut or introduce different devices into our body, remove tissue, stabilize tissue with hardware. And again, sometimes that's the right choice. Sometimes that's needed. We do refer people to surgery. But if we just compare and contrast our safety paper of 2,300 patients and the potential for complications versus surgical intervention, there's a significant difference in the exposure to potential complications when you're doing less invasive treatment options, which just makes sense intuitively. So knee replacements can carry up to a 16% complication rate, which can include very scary things like death, infection, blood clots in the lung or the legs, loosening, revision of the replaced joint. Knee arthroscopy, even just sticking a scope in, can have up to close to a 5% complication rate. And we have to remember that surgery is not a cure-all, right? People that get surgery still can have pain, still can have dysfunction. And if they have a complication, that can create even more problems. So even looking at return to full function after your knee replacement, less than 40% of people actually gain full function after a knee replacement. And in the only randomized controlled trial for knee replacement, it took about 5 knee replacements to find one patient that improved more than 15% compared to physical therapy. And so it's not always the overwhelming, miracle that we hope that it can be to help improve our knee pain and function. So there's a lot of different factors that go into that compared to some of our injection-based procedures with a potential complication rate of 0.17. And this was done over a 10-year time frame, looking at over 2,300 patients that we treated. We'll talk about how we track patient outcomes and try to keep tabs of improvements and complication rates. So it's just really understanding and being informed about the risks and benefits of all intervention, whether it be medications, injection-based therapies, surgery. You have to understand what you're signing up for. And I think a lot of times the informed consent on these, traditional treatment options gets kind of lost, and not everybody understands the potential side effects of the medications or intervention that they're getting, for example, with cortisone or those kind of things. So, Regenexx, the organization of Regenexx has been around since 2005, started in Colorado, initially a lot of research with Colorado State, and then has developed into a larger organization. We got clinics all around the country, some internationally in different countries, as we can see down here. This is on the regenexx.com website with links to all the different clinics. Again, I've been with Regenexx since 2015. I've worked at the Des Moines clinic and obviously this one in Nevada. And our goal has always been innovation, clinical research. We've always tracked patients on our registry. We use the outcomes here to help guide our treatment decisions. And as we'll learn, it's very helpful for us to understand the potential for success because we actually track patient outcomes, as opposed to a clinic that might treat people, but they never really actually formally track outcomes. So they may not truly understand what the complication rates are, what the success rates are. And there's a lot of publications that we do with randomized controlled trials or looking at registry data and educating people on the potential of what these procedures can do. And so it's really just been about advancing medicine, the evolution of medicine, and going from more invasive to less invasive treatment options, just as we've seen in other areas of medicine. For example, heart surgery. The majority of heart surgeries in the past were they're cracking the chest open and doing these open bypass procedures, where now the majority of heart procedures are done through catheterization and stent placement through vessels. So it's just taking evolution, technology, information, and applying that where we can to try to reduce those exposure to risk. And so everything that we do is minimally invasive. We're using healing factors and different cellular components that are involved with injury response and tissue healing and repair. And again, it's all about just reducing risk, reducing downtime, and trying to help preserve people's tissue. So a lot of the things that we use are kind of defined or called kind of a broad category of orthobiologics. So biologics coming from people's bodies or involved with biology and orthopedic realm. So just to set the foundation, we all understand that we have a capacity to heal. We've all cut ourselves or have known somebody that's had a broken bone, a torn muscle or tendon, or even had surgery, and your body still has to heal from those types of injuries or intervention. So we cut ourselves and we grow new skin. We break a bone and we grow new bone. So there is internal intrinsic mechanisms involved with this process. And it's just about understanding that we can identify and take advantage of some of those cellular processes and different types of cells that help promote healing, that help orchestrate the healing process, or to help activate the healing process, or keep our tissues in a balance of homeostasis so that you improve the environment so that it's more conducive for healing. A lot of times we have overuse injuries or accumulation of wear and tear, and then that kind of tips the balance of our healing cascade into more of a degenerative kind of catabolic or demolition type process. And so some of the things that we can do to try to restore that balance actually can aid in tissue preservation and improvement in those irritated tissues. So there are cells within our blood called platelets, and so we take advantage of these cells because they are really the activators of healing. They do have other functions with clotting, but usually you bleed in the setting of an injury, and so the platelets release these different growth factors that help with cell growth, collagen growth, new blood vessel production, and so these things are involved with that stimulation of these different healing processes. And we tend to use platelets when you isolate these things. That's called platelet-rich plasma, which just means we're taking blood, isolating the platelets, and concentrating them to varying levels. And we'll talk a little bit about that, not in great detail, but just a little bit of the different things we do for what different conditions. So we tend to use this for mild to moderate arthritis, tendonitis, bursitis, small muscle tears, tendon tears. We use it a lot for spinal conditions like disc bulges or herniations, things like that. You can use it around nerves like carpal tunnel. There's some studies with it using it in those conditions as well. So it can be used for a lot of different conditions. It's not a cure for everything. It's just there to help kind of manage and kind of stimulate the tissue, but can be very helpful. We'll see in a second that there's quite a bit of studies on this for different conditions. There's other proteins that can be involved, these anti-inflammatory kind of proteins or cytokines that are found in your body to help control arthritic inflammation. And so we can isolate these growth factors when we feel we should take advantage of them. Typically tends to be in arthritic joints that get a lot of swelling, where you're trying to help protect the cartilage. And so you can use that in those settings. Throughout our bodies, we do have different cells called mesenchymal stem cells, and these can be found in different tissues throughout your body. We tend to isolate bone marrow from the back of the pelvis, and the bone marrow contains these mesenchymal stem cells, and naturally these cells are there to respond to an injured environment. They're there to help maintain our tissue. They help with controlling and kind of orchestrating the healing cascade. So you think of them like a contractor at a construction site. They're really there to help organize, make sure everything's going in the proper way. And when you assess these cells in the lab, you can see that they can actually transform from their native state into these different types of cells. So cartilage, nerve, muscle. And so you can take advantage of these properties and by isolating them and transplanting or injecting them into other areas that need some assistance, you can help improve that environment. So we tend to use these for more moderate to severe conditions, larger tears, where there's a little bit of gapping. There's always limitations. This is not the cure for everything. And so you have to understand what the problems are before you start to recommend these types of procedures. And so I like to highlight, these types of graphics just to show that this is just a summary of stem cell orthopedic research out there. And this is only solely on orthopedic conditions. That's grown a lot, and we got to update this, but these are all individual studies looking at stem cells for orthopedic conditions, dating back to 1997. So it's grown a lot. This is the amount of data just utilizing bone marrow derived stem cells for orthopedic problems. Data looking at utilizing platelets for orthopedic conditions, knees, hand, hip, shoulder, carpal tunnel, elbows, spine, Achilles. So a lot of randomized controlled studies have been done comparing it to all of these different treatment options here. For knee arthritis, has a lot of studies with PRP and bone marrow. So it's important to understand that there is data. Obviously, we have our own registry data tracking patient outcomes and some of the randomized studies that we conduct, but people around the world are contributing to this kind of information. And so we try to break it down as far as deciding if a patient that comes to us could potentially benefit. We can't predict, we don't have a crystal ball to understand exactly what somebody's going to get out of it, but we do our best to try to ahead of time understand what the potential for improvement is. And so we have these 3 Ps to help improve and maximize the chance for success. Again, we mentioned everything we do is orthopedic based, treating spine, shoulder, elbow, hand, wrist, hip, knee, and foot and ankle issues, which can range from arthritic change, tears of tissues, bone injuries, cartilage injuries, disc injuries, irritated nerves, those kind of things, ligament tears, muscle tears, and inflammation. And so when people come in, we move into the prediction process. Can we start to understand what the potential is? And so we have our new patient evaluation, which is comprehensive. We utilize what we find in that and kind of compare that with what our registry data shows. We're currently tracking more than 60,000 patients and looking at some of the research that we've conducted or what else has been published. So the new patient consultation is about an hour long, where we review everything like you would expect. We perform a comprehensive physical exam. Sometimes we'll utilize ultrasound to better understand the structure. But this is where we have a big conversation about what all the treatment options are, talk about the risks and benefits of everything, and then develop a comprehensive plan. So it helps for people to understand what their problem is. So we like to show them and kind of give them a sense of what the options are. Again, we use our registry, which is published on the website, looking at, this is an example. This is a little bit older. It's about 15,000 now for knee. These are the bone marrow stem cell patients tracked in the registry. Arthritis, ACL tears, meniscus injury. So these are there, but we utilize some of this information to get a general sense of the overall outcomes. We look at our published studies and other things that are out there as well. And this all helps us determine if someone's a high responder, potentially, moderate or a low responder. There's different chances of success for each area, and every part of the body is unique. They're not all the same. The success rates are not all the same in each part of the body. So there's a lot of little things we look at that help us kind of come to that final determination on what the candidacy grade and the chance for success would be. So sometimes when we decide that what we do would be of benefit, one thing that stands apart with what we do is we do have a manual processing lab, which allows flexibility. So we have more customization on isolating those platelets, if you've heard of PRP before, people think it's all just one thing, but there's different types of PRP. When you concentrate the platelets, you can add other cells to subtract other cells, different concentrations, low versus high. And so all of that can be determined and adjusted based on age, injury severity, what's the location, what's the tissue type that you're treating. And so it's nice to be able to have flexibility in creating these different products, because a person may have a bone problem, a cartilage, a soft tissue injury, or some inflammation, and all of those things may respond differently to different types of concentrations in PRP or bone marrow or other types of growth factors. And so we do have many patents for cell processing and isolation techniques as a whole at the Regenexx network here. The other thing is just being able to, when people are looking at trying to prevent surgery, you have to be able to precisely place the cells needed in the right environment and right location in order to maximize success. And so you have to be able to use image guidance. You have to understand what the problem is, which is why you have to have imaging ahead of time to know exactly what you're dealing with. So for example, this is a MRI of knee with knee arthritis and a bone injury of the kneecap. And this is a procedure targeting those areas with a cellular-based injection. And so this just kind of gives people the higher chance for success when you know you can place these cells in the right location. An X-ray looking at the shoulder injection, an ultrasound injecting around the carpal tunnel nerve with platelet growth factors to help with carpal tunnel syndrome. So being able to use image guidance is going to allow you to be more precise, safer, and to give people a better chance of success. So that's an important part of how we perform procedures once we get through each stage of even deciding if what we do would be of benefit. And so when we're talking about blood-based procedures, it's just a one-day type procedure where we do blood draw. The processing takes about an hour to hour and a half. And then all of the re-injection of those areas are treated that same day. Now, this is just more of a general overview, right? We will have some webinars more specifically to knees and backs and other joints, but just trying to give kind of a basic sense, and we can answer more questions if we need to. But any type of treatment is going to lead to a little bit of activity modification for at least a few days, sometimes more if you have more extensive problems. Some people will need therapy, like physical therapy. Some people will need bracing. Some people might need some medications to help get through the post-procedure time. There's always some percentage of people that will need more than one treatment over time. Depends on the location, severity, and a lot of different factors. So it's not always a one and done. And again, it depends on what we're treating, what the condition is, that kind of stuff. So it's always good to keep that in the back of your mind. The bone marrow protocol for arthritic joints can be a little bit more involved. So if we're isolating bone marrow and isolating those layers where stem cells are found, we tend to have a 3-step process. Again, we're just trying to recreate the natural healing cascade. Healing initially is inflammatory cells, and then that's what recruits cells to the area. And then a couple days later is when we isolate the bone marrow and extract the cells and count them and then place them back into the joint. And then we do a post-injection. So this is just to highlight that we do have a protocol that's been studied on many different conditions, using some FDA-approved adjuvants and platelet mixes to help, again, improve the potential for improvement of arthritic joints. And so this is all discussed during an evaluation to give people the better sense of what's involved, what's the potential for success. And we tend to use this mainly for this kind of 3-step protocol for more severely arthritic joints, where we need to really get as much stimulation of the area that we can. It's always important to note that, like all medical procedures or medications or intervention, it's good to understand the fact that there's nothing is kind of 100% effective for 100% of people, and a lot of these things have limitations. And so there is a lot of hype and kind of misinformation about what different types of regenerative therapies can do, what conditions can it treat, and how much structural change would we expect. And so, you know, there are big limitations that we've seen over the years with our own research. And so we're not necessarily growing a whole brand new joint if you're starting out with bone on bone completely, right? So it's not just restoring everything as if you never had a problem in the past. So we have to understand that there is kind of a sweet spot where people have the higher chance for success. And then there's some people that are just too far gone structurally to create any change in the overall structure. Doesn't mean you can't get some improvement in pain and function. It just means that some of the structural changes may not be significant depending on what you're starting with. So it's always important to note that. It's also important to know that FDA does regulate human tissue and cellular products, and they also regulate medications, and they define these things. And so there are certain things like umbilical cord stem cells, or products or amniotic or placental tissues that, according to the FDA, are unapproved. They consider them medications, and they are not technically legal to provide to patients for any condition outside of blood-based cancers like leukemia. So we do not utilize umbilical cord products. One reason is because of this. Another reason is we've checked many of the products. Most of it's dead tissue, so there are not really many viable cells outside some growth factors. There is some studies published from our institution and Colorado State assessing the ability for stem cells to grow from umbilical cord products found in the US versus just taking your own cells, where we can get cell growth from your own cells, even middle-aged people in their 60s, 70s, and 80s, versus these umbilical cord products in the US that grew 0 cells. None of them grew a single cell. And so it's important to know that some of this information is out there. There's been prior recalls of umbilical cord products from Livion. There's more growing studies, but none with the products available in the US, which are different than what's available outside the US, where they can actually grow and purify the cells from umbilical cord tissue. And I just like to say, so the barrier to entry for utilizing umbilical cord stem cells is 0. So as long as you're a doctor and you have a clinic, tomorrow we could order thousands of vials of umbilical cord cells. We are one of the largest and oldest organizations utilizing and focusing on regenerative therapies for orthopedic conditions. So if we thought that they were the best thing, there's no reason why we couldn't just provide those as an option. But because of the legal issues, because of the lack of verification of what's in those products, there's no standardization. A lot of the warning letters have gone out because a lot of the companies are not assessing the donors for communicable diseases like HIV, hepatitis. And then a lot of the data is lacking in human outcome data, even though it's growing. So that's good. That's what we want to see, because it will be nice to have some products that we can use that are off the shelf to help people get better with their orthopedic conditions. But for now, our clinic is still utilizing your own cells, and we've checked outcomes from people in their 20s to their 90s. And so there are some very specific cases where age plays a role in outcome, but in most cases it doesn't. And so people tend to ask that as a question. Within our own clinic, we do utilize the MLS laser. So it's a non-invasive treatment for helping with pain, inflammation, recovery, and healing. There are many studies looking at it for post-surgical recovery, just muscle strains and pains, inflammation. And so we utilize it as its own option or even in conjunction with procedures. So we just like to let people know that there are other even non-injection based therapies out there to help with orthopedic pain, healing, and recovery. So let's see if there's any questions. I don't see any written down yet. I will at least put this screen up, which is just giving some of the contact information to our call center. You can contact Lauren at her email or via the phone number. So if people had questions about wanting to get their information sent to us or your imaging or other questions, just more specifically on a condition, they can really help at least get you some initial information or even get you in for an evaluation. For evaluations, we are contracted with most insurances to cover the cost of an evaluation, just like it would be for you to go see an orthopedic doctor. A lot of the procedures that we perform, like platelets or bone marrow stem cell, are not covered by insurance. Now, we are the only organization that has some insurance coverage through self-funded companies. So we have 1,300 companies, or maybe 1,400 now, that cover our procedures for their employees. But your traditional private Medicare and United, Blue Cross, Aetna does not cover the procedural, the procedures that are when we're utilizing the Regenexx type procedures. Obviously, they cover evaluations, MRIs, if we did cortisone or if we did gel injections of some sort, then those things are, things that can be billed. So it's important to know that there could be a kind of a self-pay component if we ever thought about moving forward with some of the platelet, blood-based, or bone marrow-based procedures. So went through that pretty quickly. A lot of talking on my part. It's always doing the webinars. There's not a lot of feedback from people listening, so kind of break it up a bit. But I don't see any questions yet. I'm trying to think of things that people typically ask. As I said, there's even before procedures, there's some people that have medications that can interfere. So like blood thinners, certain cholesterol medications, anti-inflammatory medications, steroid medications sometimes need to be adjusted. Post-procedure, the biggest thing is there can be some downtime, just for a couple of days through the first couple of weeks. Some people need therapy, some people need bracing, some people will need repeat procedures. So we do have a question about, does one need a recent imaging prior to evaluation? No, not necessarily. If it's hard to get in to get some type of imaging ordered, or you're not really sure what you might need, you can still come in and we can be the ones to order the imaging, so that we understand exactly what we're trying to look at. In the clinic, the only thing we have in the clinic is a diagnostic ultrasound. So we can look at like extremity-based things with that and get a general sense of stuff. It doesn't help with spinal conditions. So depending on the problem, we might have to order an MRI or X-ray or CAT scan or something, but we can always make that determination within the evaluation. We like to have imaging that's 12 months old or newer, sometimes a little bit longer if there's been no change, depending on the location, like in your symptoms. So having imaging ahead of time can be helpful because it just facilitates the conversation quicker, but we order imaging for people all the time. Yeah, you don't need it for knees. We can look, so it says specifically for knee imaging. Yeah, we can look with ultrasound in the clinic. And then sometimes if we felt we needed an MRI or other types of imaging, then we can order that and help get that facilitated to get that information. So it's not absolutely needed, but if you happen to have an MRI performed within the last year, then you can bring that and we can look at it and go over it and kind of discuss how that relates to what we do. And then if you had imaging and you just wanted us to look at it for just a quick review to see, is it even worth coming into the clinic for a more formal consultation, you can always send in your imaging or give us access to it, and we can review it to say, yes, there's potential, or no, there's not potential, that kind of stuff. So we do that as well. Any other questions that anybody has on anything? I know tonight's webinar was more of just the general overview of things, just trying to plant the seed, understanding that there's different types of clinics, there's different types of treatment options. Again, we're talking about orthopedic conditions, but getting people to think of differently and not just fall into the routine of, you know, what's traditionally recommended. Understanding that, you know, it's good to have a good overview of what your condition is, maybe even a second opinion if you saw a surgeon, because we spend a lot more time with you. We do more in-depth evaluations, physical exams. All of our consultations are an hour or longer, as opposed to some orthopedic clinics where you might get 5 minutes with whoever the provider is. And so it at least gives you information, if nothing else. So it says for knees that have had gel twice with a year of relief, PRP or stem cells. Well, it's tricky to say, but there's 16 studies. I'll go back, see if I can find it. Sorry for going so quick on this. So this line right here, these first like 18 studies or whatever, is comparing PRP to the gel, with every single study showing PRP to be more successful than gel. And so if you're responding to the gel, then PRP would potentially be an option for you. And then we still want to look at the tissue to see what we're treating, but at least based on 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 studies showing PRP to be as or more effective than gel-based injections, then you likely could be a candidate for a PRP procedure. Good. Well, let's do one more minute, and if nobody has any other questions, then that's great. I appreciate your guys' time this evening to just listen and take in some information. Again, reach out to us if you have more questions. If you ever want a consultation, there's really no downside to coming in and getting some more information, you know, outside trying to drive in and come see us, but it can be useful with just understanding your condition. So I appreciate your time. I don't see any other questions. Reach out if you need us. And again, thank you again for your attention and for logging in and learning more about Regenexx. Thank you.